Okay, Assalamualaikum, hello, hai dan selamat malam. Selamat datang ke siaran podcast OMFS setelah kita cukup setahun. First episode pada tahun lalu dan tahun ini kita kembali sekali lagi dibawakan khas oleh Malaysian Association of Oral Maxillofacial Surgeon di Subang Podcast by War Studio USJ Summit. Okay, apa khabar penonton-penonton yang sedang menonton di channel YouTube rasmi MAUMS menerusi tablet, phone ke laptop ke. Terima kasih kerana sudi menonton. Jangan lupa subscribe ya dan share kepada rakan-rakan anda untuk menonton podcast kali ini, dan kalau ada soalan yang ingin tanya boleh catatkan di ruangan komen di bawah YouTube anda. Okey, pada yang sedang memandu pulang, saya tahu sekarang ni yang minggu depan adalah minggu perayaan Chinese New Year, cuti sekolah dan juga ada sambutan Ramadan. Berhati-hati ketika memandu. Always remember your loved one. Untuk adik-adik Fido yang sedang menjahit ke buat debridement tu, teruskan menjahit ya, fokus. Okey. Anda bersama saya Zulfikar Samsudin selama sejam setengah ini. Dalam podcast khas ini kita akan berbual bersama dua orang panelis jemputan khas bersempena dengan hari ini 13 Februari, iaitu Hari International Oral and Maxillofacial Day. Yes, today is 13 February, hari Jumaat, merupakan International Oral and Maxillofacial Day to celebrate the contribution oral and maxillofacial surgeon make to society around the world. Saya nak bacakan sedikit sejarah. Okay, International Oral Maxillofacial Surgery Day was officially started in 2019, dan it was formally launched by the International Association of Oral and Maxillofacial Surgeon (IAOMS), dan tarikh 13 Februari telah dipilih untuk meraihkan hari ini. Dan sejak tahun 2019 kita telah menyaksikan pelbagai aktiviti telah dilakukan di Malaysia sendiri. Kita ada academic and lectures and webinars, kita ada public awareness campaign, kita ada juga universiti dan hospital melakukan banyak event, dan juga social media outreach highlighting the scope of OMFS. Okay, and this year podcast team is dinamakan Beyond the Scalpel, the future of OMFS Malaysia. And untuk berbincang ataupun bersembang-sembang lah, this is not serious, ini bukan seminar ke conference. Kita menjemput dua orang panelis. Di sebelah kiri saya yang kacak bergaya, memakai spion mata, Associate Professor Dr. Rama, dan di sebelah sana yang memakai baju biru, jaket blazer biru dan hitam, iaitu Dr. Azwin. Associate Prof. Rama merupakan konsultan di Fakulti Pergigian UKM, betul ya, Prof. Rama? Dan juga Dr. Azwin merupakan konsultan di Hospital Kuala Lumpur. Thank you for coming, guys.
Thank you.
Okay.
Thank you. Thank you.
Kita pun tak sabar nak mendengar perkongsian berkenaan kita ni nak sembang-sembang bagaimana perjalanan you daripada seorang doktor gigi kemudian menjadi seorang consultant in oral maxillofacial surgery, dengan harapan kita boleh inspire our future young dentist yang nak become macam you all lah. Okay, shall we begin?
Yes.
Alright.
Yes.
Okay. So my first question, many kita borak dalam dewasa, okay, alright. Okay. My question, many moons ago kita nak tanya about your background. Sekolah kat mana dulu, SPM macam mana, waktu sekolah dulu macam mana, you seorang macam mana, pendiam, pemalu ke apa, kita nak cerita sikit. It's like warm up session lah. So kita nak mulakan dengan siapa? Mr. Rahman dulu lah.
Okay.
Right. So firstly, of course, I would like to thank the Malaysian Association of Maxillofacial Surgeons for the kind invite for us to share our journey. I would like to wish everyone happy International OMFS Day. It's indeed a day that we should be proud of. And Azwin, I think we agree. Zul has a lot of talent to become a radio DJ.
Aduh.
True. Macam lama kan mula tu dia.
Thanks.
Okay.
Alright.
Okay.
Focus.
Sorry. Alright. Okay. Coming back to the main topic. Right. So well, I am from Ipoh.
Yeah.
Anak Perak.
Anak Perak.
Yes. I come from a grounded, humble, disciplined family. I must stress that.
Your father must be a teacher, you
Your
see.
father is a teacher and a discipline teacher.
Discipline teacher.
Yes.
I see that.
So you can see how disciplined I am, right? Yeah. So I did my Form 6 and Form 5 in Anderson, Sekolah Menengah Anderson, known for their hockey.
Hockey?
Yep.
Did you
But
play
I
hockey?
didn't play hockey.
Oh, alamak, sayang.
Tengok size lah, takkanlah main hockey. Alright, so yes, so I was there, and then of course from there did my STPM, and then entered UKM, and I'm still in UKM. So I'm a proud UKM alumni as well, and yeah, that humble beginning started there lah.
Okay, it's very good. Okay,
Okay,
Dr. Azwin.
as for me, I was born in Jelebu, Negeri Sembilan.
You're born Negeri Sembilan.
Okay, my mum from Negeri Sembilan, my ayah from Perak.
Okay.
Okay, my dad dia dulu pemandu apa? As a driver lah.
Okay.
Dia hantar, kalau you all masih ingat lagi lah, Angel Cake House. Dia hantar yang
Bakery.
roti-roti bakery. Yes, dia akan hantar. So masa dulu memang kita orang selalu dapat makan apa ni? Roti free memang every day lah. Now we have to buy. And then like my mum kerja Motorola.
Okay. Sekolah mana dulu?
Sekolah dulu Sekolah Sains Tunku Abdullah, Raub Pahang. Okay. During school days kan, I'm a shy person lah.
Shy person,
Boleh cakap macam introvert sikit lah. Macam introvert sikit lah kan. And then after SPM, pergi asasi UM. And then go to apa ni lah, dentistry in UM lah.
Okay, right. Cool. Tapi kita nak kembali kepada zaman kanak-kanak sekolah rendah. Dia ingat tak dulu sekolah rendah kita pernah cikgu suruh pilih 3 pekerjaan utama. What do you want to become at that time? 3. So, kan biasa orang apa? Askar, bomber, kan, polis. Do you remember?
Yes,
Ingat
I
tak?
do. In fact, it was worrying because I actually wanted to drive a dustbin truck.
Aduh.
For the longest time, that was my dream.
Okay.
You won't believe. You can ask my mother.
Okay.
So after a while, you know Indians they have to be lawyer, teacher, or doctor.
Yeah.
So then they start to get worried lah. Anak aku ni macam mana kan? Okay, but yes, that didn't happen, of course. And yeah, so he started off with that, and then I think it was always actually I wanted to be an engineer.
Engineer.
I don't think dentistry was ever in my plan at that point of time. It used to be engineer, doctor, and lawyer.
Lawyer. Waktu sekolah rendah pun dah fikir macam tu. Very good.
Sekolah rendah tak, it was dustbin.
Like the dustbin truck. How about you, Mr. Azwin?
Like me, my first choice I would like to become a doctor. Second to be engineer.
Wow.
And then the third one, I pun tak tahu kenapa I pilih, because I want to be a geologist.
Geologist,
Because of my cousins kan, they grad in geology. So I just follow je. Usually dulu kan kita just follow saja kan.
betul,
Siapa
betul,
kita
betul.
punya role model tu, so kita nak follow macam tu sajalah. Okay.
Okay, interesting ah. Saya ingatkan you all akan pilih jadi polis ke askar ke bomber, but you all pilih yang atas-atas punya job. Okay, alright. So now kita nak go to macam mana you boleh berminat untuk join dentistry?
You want?
Okay.
kan?
Me first lah. So asasi dekat UM, alright. And then masa tu kan kita akan pilih kan kat mana kita nak masuk semua kan.
Ya, betul.
And then my cousin ada physicians, and then biasalah kita dulu mak-mak kita dulu kan akan berborak kan apa nak buat kan. Betul. Yes, compare nak buat apa. I have to admit that I'm a creative person lah. I'm good with my handwork. I can admit that lah. Art memang apa ni lah. Saya suka. And then bila masih kat UM tu kan, kita ada pergi buat lawatan to faculty tau. So we went to Faculty of Dentistry UM. And that time I saw Prof Zainal duduk seorang-seorang dekat tengah, Prof Datuk Zainal lah, nama Datuk Zainal. And then the whole chair kan is the students wear white coat. Cakap, wah. Masa tu rasa macam, wah, dentistry, maybe
Not
apa ni
bad
lah,
kan,
not
not
bad
bad
lah,
kan.
dentistry. And then, you see lah, Datuk Zainal kan, with the bow tie dia.
Yes.
Oh, look very full. Itulah, kita rasa macam, maybe dentistry, I'm good at artworks kan.
Yes.
So maybe it's one of the choice lah.
Betul lah.
So,
This is what always dentist student waktu itu interview kan kenapa nak become dentist. It's a combination of art and
Yeah.
science. Okay, how about you, Mr. Rama?
Honestly, dentistry was not in my plan.
Okay.
So of course, at that time when we apply for university after STPM, you have to have your 5 choices.
Okay.
So my first 3 was medicine, UKM, USM.
Okay.
Then my last after that was UPM medicine, 4th choice. Last choice was UKM dentistry.
Dentistry.
So I got UKM dentistry.
Okay, alright.
Because my STPM results was not good enough lah for medicine at that point. So that's how I entered dentistry. So honestly, when I entered, I was not the happiest person.
Oh.
Yeah, it took me some time
Because you got the
to.
4th choice, is it?
I got my last choice.
My last choice.
Last choice, and that one pun macam okay lah, terpaksa terima budak ni kan, okay, bagilah something to him. So I was. It took me almost I think 3 months to accept. I was still like trying to go into medicine,
Okay.
hoping for, people used to say you masuk lepas tu you boleh tukar. And then, so after that, so that's why the first 3 months was really a blur for me in dentistry. And today my dental anatomy suffers because of that. But then after that, of course, along the way, the interest came, and that's how it unfolded for me.
Yeah.
Not as straightforward as, I wanted it, but I guess God is the best planner, right? So
betul.
But eventually,
Agree. Yeah.
you've got
Yes,
your second
yes.
degree in MBBS.
Yeah.
Okay, all right. We talk about that later.
Yes.
All right. So, lepas habis dentistry, boleh kat mana you being posted? Your first posting?
My first posting dekat Hospital Alostar, Kedah.
Oh,
For 3 years.
And
Yes.
that was what year? Tahun berapa itu?
2003.
3?
Yeah,
Okay.
2003. Because I'm batch 1998, 2003.
Okay.
Okay, so 2 tahun setengah. I was in Alostar, Hospital Alostar. Bukan Hospital Sultan Abayah now.
Okay.
Saya Alostar yang lama dulu.
How was the experience like last time?
Oh,
Dulu
last
kan kita
time,
ada 3 years. kan,
last
compulsory
time kan
service
we have to do like 6-month posting in
Betul.
OMFS, and then like depends on center, depends on negeri. 4 months in dental pits, 1 month in ortho, 1 month in perio. So complete 1 year. So 6 months I was in OMFS kan.
Okay.
Masa tu memang I
Dan
enjoy
nampak
lah.
bunga-bunga dia tu.
Bunga-bunga. I think because I was
Inspired.
handpicked by Datuk Yusof lah.
I see.
Datuk Yusof yang dia nak someone kan to be in the hospital.
Okay.
And then satu lagi, actually what inspired me lah to work in a hospital base, right? Because masa tu I think some of you kenal Dr. Zaini. Dr. Zaini was yang menjaga lah YM Hospital Alostar. So bila Dr. Zaini akan arrangekan semua cases for op, and then dia akan case semua dia akan tengok semua kan, and then bila dia tengok CT scan kan, wah, as a Fido, boleh tengok CT scan, serious, I want to be like that lah. So actually Dr. Zaini also inspired me lah.
In a way.
Betul.
Okay. How about you, Mr. Rama?
Mine, I got posted, also didn't get what I wanted. So that's challenges in life that I faced at the young time. I wanted Ipoh, Melaka, Seremban.
Semua tak dapat.
They sent me to Kuantan.
Kuantan.
So
Kuantan
I
not
was,
bad, what?
yeah. So first they wanted me to be in Temelo. They wanted me to be in Temelo. Then I said, can I be in the city? I still remember telling the TPKN, I want to be in the city. Then she said, okay lah. And then we went to, and I was in HTA. So I was there for 1.5 years. And then managed to get pelepasan dengan izin to join as training lecturer in UKM from that point.
How long were you posting in that time?
So I was, that time was the same. We was doing the FIDO kan masa tu. So I completed all my FIDO
3 years.
postings. Yes.
3 years.
Yes.
Before you
But
joined UKM.
so yes, I completed all the FIDO and then I came back to UKM.
Okay, good. Alright. So now barulah kita nak pergi ke bahagian oral maxillofacial surgery. Tadi
Serious stuff.
Serious stuff.
Serious stuff
Okay,
kan?
now serious
Okay,
stuff.
tadi Mr. Azwin ada cakap yang inspired you Dr. Yusof and Dr. Zaini. Okay, what about you? What first inspired you to pursue oral maxillofacial surgery?
So I think like you were good with your hands. I was not good in my hands. So every other specialty in dentistry was tough for me.
Mr. Ramani humble sangat
Tak,
lah.
betul. I am more of a, I think I'm more of a, robust and destructive person. So I just liked oral surgery from the beginning, actually, to be honest. I always had the highest extractions and I would look forward to oral surgery clinics. Although the oral surgeons were always the most strict as well, besides prosto lah kan. So I used to enjoy it from that point. So actually, to be honest with you, from third year onwards, I already knew I wanted to do oral surgery.
Really?
Yeah.
My interest was there only. The others were a struggle for me, honestly. But I completed my requirements lah. But I knew I felt that this was what I wanted to do. Indirectly also, I think because I still held on to wanting to do medicine. So in my head, I felt that this would be the only pathway that I can still do medicine. That's what
true.
technically
That's what
inspired me
people
lah.
think like
Actually betul,
about
because
medicine kan.
apa ni oral surgery kan, we work in hospital base.
Yes.
So yeah, some people we enjoy to work in hospital environment.
The grill,
Yes.
the on-call.
Yes, betul. So so for me that was already I wanted to do it lah.
So anyone inspire you? I mean like, someone yang
I think at that point maybe no yet.
No
It was just I wanted to do it.
Really?
But of course along the way then I was born with it, So but I just loved it lah. I had the liking for it. Yeah.
Okay, alright. So now kita nak cerita pasal how long have you become a specialist? I mean the day you gazetted, dah berapa lama?
2010. For me 2010.
So almost 16 years. How about you?
Yeah.
Gazetted 2011.
2011, so about 15 years, more than a decade. So your training dekat mana?
Okay, so I was sent to Hong Kong U.
Okay.
I was privileged that the government at that time was still sending us out overseas.
We ada lucky.
And we were, were the first, I think we were the second batch of Malaysians, because Dr. Azmil was the first batch pioneer in Hong Kong U. And then we were the largest batch of Malaysians in
I remember
Hong
I
Kong U.
visited them lah. Our batch in Hong Kong.
So I was, and that time
All the big guns kan.
we had Prof. Chong, the late Prof. Chong, and of course Prof. Saman, who was there. And so that's where I got my training lah. I learned a lot there, and till today we still remember those times.
How about you, Mr. Azin? You
UM grad.
Yes.
Okay. After 2.5 years in Alostar, then I joined master program in UM.
I didn't easy to get like secure place.
The good thing about during our time kan, tak ramai orang nak buat.
Betul.
Kan, sekarang macam banyak.
Like in my batch kan, because I joined lewat sebulan lah, because I didn't get scholarship for the first year. I tak dapat scholarship. So I withhold for 1 month. Masa tu my batch only Dr. Rosli and Dr. Hazme. Only 2 person in one batch. Kalau I tak masuk, memang only two of them saja yang doing master. Then I joined them, and then 3 of us doing master. The whole country.
Semua lelaki.
Semua lelaki.
Semua lelaki.
Yeah.
Lelaki terkacak. Okay, so what were the biggest challenges you faced during the training? Of course kan, Hong Kong, living cost high.
Yeah, so it was a lot of adjustment, I must say.
Okay.
Tell
us.
So there were, so of course from the becoming humble, because our money was really very, very small there. I still recall, I think the 4 of us, me, Prof. Izraus, who is now the Dean, Prof. Said and Fahmi, right? 4 of us stayed in if I'm not mistaken, maybe a 400 square feet apartment.
How can you
Betul.
squeeze
So you've been
Betul,
there, right?
yeah.
all of you?
Ya, memang tak boleh. Seorang je boleh masuk
Dia
tandas,
memang
keluar.
cakap, semayang kan, bilik dalam bilik.
Yes.
Bilik ada dalam bilik.
Yeah, correct.
Semayang atas katil lah.
Exactly. So it was a lot of adjusting there. Of course, money also wasn't that much. But what was beautiful in Hong Kong, I must say, is how we Malaysians actually became very, very close.
Yeah.
That was, I mean, I still remember those times. I think those were the best times of my life. We were so close.
Yeah.
we would go to all the others had families because I was not married. So and they were very kind that they would always call me. I would go and eat their food and all kinds of things. But we became very, very strong knit family. And today we are like that. We still have our group. We still talk and help each other. So I think that was the first thing that I appreciate a lot about Hong Kong. How it brought us as Malaysians together, all races, everybody. And then of course I would say the mental fatigue. I think in all OMFS training there is always that component of fatigue. We have to be we of course we had a lot of model surgeries to do. There was always hospital, and those were they had OT every day in Hong Kong. And they have flaps all the time. We 1 hour monitoring. So those 3 years were basically challenging in that sense. You're being away from everything and learning to adapt to a new culture. People spoke Chinese, but I must say,
speak Chinese?
Well, at that time we could. But to be honest, the Hong Kong team were also amazing. They knew we were struggling with language, and they will always help us. And today they are also one of our best friends all around the world. So yeah, so it was challenging as well as enjoyable, and definitely life-changing for all of us.
Good. Okay, how about you? And,
during my master degree training, right?
Yep.
I think tak banyak sangat challenge lah, because masa tu kita buat kat local, right? And then
challenge juga tu.
I'm still single. But I look at from this perspective, if you're passionate doing your things, kan sometimes you tak rasa sangat. Betul. Because you love what you're doing. The challenge kan bila during my area of special interest training sebenarnya, when I went to Shanghai for 2 years kan. So totally different culture, everything. First 2 weeks kan I dah menangis dah. Because how I'm going to stand here for 2 years.
And you were alone, right?
I'm alone.
Even worse.
I'm alone, yeah. And then satu lagi because masa tu dah kahwin. And then just one occasion yang because my wife got miscarriage, local. Yep. So I have to balik ke Malaysia start. So because previously ada incidents happens lah masa tu during my training juga. So masa tu memang very challenging in terms of not because of you undergoing the training tau, but the people around you.
Yeah.
So kita kena jaga jugalah itu. Once you have someone kan with you, memang kita kena take into consideration jugalah. So that's the challenge lah to me, to jaga
the surrounding.
Yes.
Not because of the module of the studies.
Sometimes
kalau
lah.
you minat, apa-apa cabaran diberi, of course you can.
Yes.
Tapi yang di sekeliling tu yang
memang challenging lah during that time. Memang challenging. And then my wife alone kan masa tu dekat Kuantan. Memang is challenging lah.
But you see, I think we will both agree that informal training actually builds resilience in you as well. So you indirectly you also build this strength that you carry through your work as well.
Betul.
Resilience, I think, is a very important thing to have.
Okay. So now, after 15, 16 years, I can consider you as a senior consultant, would say. Okay. So how did your transition from the trainee to independent consultant?
I think the most challenging one was when we came back and you have to be a specialist.
Yeah.
I think as a trainee, you always have that safety net of your supervisor is there. Like in Hong Kong, kita orang buat automatic, something goes wrong, call Prof. That Prof. will come and save us. And then when I came back, I still remember the first case I was doing with Syed. And I was like, who do we call now if we have problem? I look at you, you look at me. We hope we have been trained enough. And that is actually more scary when you're standing on your own 2 feet. But yeah, that is how you learn, and you will learn how to grow further. So I feel that step is probably the most challenging. But if you have seen enough in your training, I believe that you will pull through.
Yes.
But everything yang happen pun is a learning, right?
Correct.
So this is how you learn. You just
Correct.
never stop learning.
Yeah.
How about you,
Betul.
Mr. Azwin? Kan daripada trainee.
Which is betul. Once macam I habis my training kan in the area of special interest, and to come back, and then of course people expect me to do something that
True.
betul tak?
You kena buat decision.
Yeah, you go for training kan, and then that's the reason I asked for 2 years actually, because I went to Shanghai kan without zero knowledge in oncology. So that's why I know oncology is very challenging. So the first year I just concentrate on ablative part, and then the second year I concentrate on the recon part. So I know it's not easy. So when I come back, I must make sure that we can perform lah, betul tak? Tak adalah kita takut-takut kan nak buat kan. Kalau tidak rugi sajalah kan. Kita pergi sana. So first time tu memang challenging lah, but the good thing is I have a good support lah from colleague, and then from people around me lah. So itu pun rezeki lah sebenarnya. Rezeki memang betul.
But in China, do you have any difficulty like learning because the language barrier?
Oh betul. First memang difficult, but I went to private class kan every week. So I learn Mandarin. I ambil HSK level 2.
It was amazing. I saw one of your videos.
Level 2.
Chinese talking.
Wow.
Yes.
Does it become Chinese?
I got the highest mark.
In Chinese.
I got the highest mark. Yes. But HSK level 2 ni actually is a level tadika je.
Okay lah tu.
Untuk communication lah sebenarnya. So it's interesting lah dia punya experience, because once you know how to communicate, because in China everything is Mandarin, so we can communicate with the staff nurse. And then sometimes macam dekat sana pukul 1 memang dia akan break makan lunch kan. So I was the only one alone lah scrubbing, and then together with the staff nurses. So we communicate each other lah to do apa-apa. So I see that is extra advantage lah once you know the language, and then people will welcome you.
Betul.
So macam tu lah you nak gain trust lah from other people.
True that. Okay, interesting. Okay. Pada penonton, kalau ada apa-apa soalan yang ingin tanya, boleh tulis di bahagian ruangan komen di bawah YouTube. So kita akan cuba bacakanlah kalau ada soalan. Okay, so now we go for the next segment, the practice identity and sub-interest. Jadi dia ada sentuh pasal ablative and reconstruction. Recently, Mr. Rama, you have been appointed as the member of World Sleep Society Education Task Force. Good job, Chang.
Thank you.
Yeah, sorry. Okay, the World Sleep Academy program, which are recognized by the American Academy of Sleep Medicine. I dapat tahu you are the first dentist in the world yang become the members of this society. How does it feel?
Well, it is a privilege, definitely, and also a big responsibility. The reason being, I think I have been, of course, going around and speaking on our research, which we've been doing, and highlighting how important dentists, we have always been the second fiddle, sometimes third and fourth fiddle also. And people, so people don't think that we have a role. But actually, we are one of the most important role in screening, and so I've been trying to, promote our research and bring new ideas, and through these talks, they have recognized that yes, there is a missing link, especially when we talk about sleep disordered breathing, which is becoming more and more important actually across globally. More importantly in Asia. So why they were interested in me as well, because one, of course, the dental background. More importantly, they wanted Asian. Because they find that Asians are more susceptible actually. What as a lot of the American thing is on their bigger skulls. You see? So it doesn't apply. The guidelines that we use, which we are following them, doesn't really apply to us in a straightforward way. So so that was how it came about. But now there's, of course, extra work. But yes, I am happy to take that one. Actually, it's something that I like doing as well. So, hopefully I can deliver.
Okay. But how did you develop that interest?
So of course, when I was in Hong Kong U, I did always like to do alternative surgery. Partially, I would say because of the late Prof. Chung. He did inspire me to a certain degree, and alternative surgery was something that I really like doing as well. Oncology, I felt I couldn't do oncology lah. I don't know how. I respect Azwin because
Azwin lah.
number one, when we were assisting at the 1 hour flight, that was already too much for me. Like, no, not going to do this. And I feel there is so much of responsibility and emotional stress with oncology, which I felt it was not for me lah. Yeah. So alternative on the hand is different. It does give us. There is also a stress with it, but the outcome is actually satisfaction, and that's how I agree with you. It's very important how your mentors are. We all stand. What we like is based on who trained us actually, and you start to develop that liking there. Even like for us, I'm sure where we are today is because of our seniors that have brought OMFS to a certain level. Yeah, so and we hope that the people below will continue the legacy. But yeah, so Prof Chong was the one that actually I always used to like his style. He's so calm. You ask any of them, no matter how stressful, he maintains his composure. Yeah, so that's how it started. So it started with skeletal surgery. And then, of course, when I came back, then I started to go into obstructive sleep apnea. And when I used to do obstructive sleep apnea, I used to think that there has to be something more than this. You know, it's like you're doing MMAs and there's so much risk. People are suffering with the surgery. No one wants to do the surgery, despite you having OSA, which is, very severe. So that's why I started to look back. And now we have changed certain algorithms in our management. And I realized there's so much more to orthognathic surgery, which we can incorporate much earlier. And this is actually in our field. You know, it is actually a domain of orthognathic surgery that we hold. Nobody else would, well, of course, people can come if they want, but we know this is our strength, orthognathic surgery. And always, Prof. Chong always say, remember, always keep orthognathic surgery with us. And now you can use it for airway as well. And that's how it started lah. And sure enough, I mean, we've been doing quite a bit of this airway-driven orthognathic surgery. We're using the proper parameters to see the response, and we're seeing it. So that's how I went into that.
That's very true. So Mr. Rahman ni macam bridge antara
and that's why I feel So I feel that is the way we can really, bring OMFS in.
That's great. Okay, how about you, Mr. Azwin? Yesterday, I saw kat you punya Facebook, you and your team celebrate a significant milestone, 200 free flap reconstruction for oral and maxillofacial defect. Well done.
I hope they're clapping.
Okay, over a decade of practice with only 12 failures, this represents a remarkable 94% success rate. That's fantastic.
Thank you. But actually it's a teamwork lah.
Teamwork.
Kita tak boleh buat seorang-seorang lah. Kan oncology work kan mana boleh buat seorang-seorang. So it's a good teamwork, good support from our officers, and then from our specialists yang lain pun. Very good support lah. But to tell you the truth, right? To go to that level, it's not easy lah sebenarnya. I tell you the first flap kita buat in HKL. Masa balik, I buat radio forearm. Everything okay semua. Hari kelima kan, ada venous congestion.
Alamak.
My first free flap in HKL, got venous congestion, and then kena bring back the patient for emergency OT. Masa tu I was really malu lah. Panic pun ada, malu pun ada, nak masuk balik OT kan, to do back to salvage the flap lah. Masa tu really macam this is the rasa macam
the feeling
tu rasa macam panic semua apa kan. But then alhamdulillah flap tu okay. We managed to salvage the flap. And then after that kita buat we started slowly lah actually. First 100 we managed to achieve in 6 years. 6 years we managed to get first 100, and then the second 100 within 4 years.
Within 4 years, that's very fast. People start trust. I mean, like you become a center, people sign.
Yeah, almost every week lah we have cases, and then at the moment now, usually kita akan boleh tahu lah when the flap is going to have a problems during the surgery. So kita boleh estimate lah, and then along the years kan, kita dah matured lah in our surgical skills, in our expectation from the patient. Our case selection pun penting juga. Yes, case selection lah I think the most important thing. But alhamdulillah lah, so far alhamdulillah dipermudahkan.
Kan I think 94% is quite high.
It's very high.
Kan very high kan. So good job HKL.
Thank you.
So how do you manage the stress when you first came back?
Betul lah.
Oh, first
But
came
when
back.
you're doing the flap, right, the first time, because flap is such a big thing. You got donor side, you got the recipient side. In your head, right? If let's say there's a problem, how do you calm yourself down? Because you are alone. Nobody else can help you, right?
Yeah.
Technically.
Yes,
the expert.
true. That's why actually kan memang stressful juga. Honestly kan, for the first few years kan, after each cases, I cannot sleep well. Phone memang kat sebelah je kepala saja, and then ask whether ada problem ke tak, But at certain level kan, you dah macam comfortable tau.
Yeah.
You know, you dah expect that okay, this is okay, this is not okay. Sometimes sometimes we have to come with a decision tau. A good decision. That's why to be as a surgeon lah, I think kita kena calm. Kita kena calm because we cannot suka marah-marah, anger.
Of course.
The reason why, because we are all born to be a good surgeon. But if you tengah marah ke, you are in anger, right? Your decision comes from your emotion, not from your mind.
Yeah.
So that's why I think the most important thing kan, kita control the environment lah in our OT. So when you have a sound mind, your decision, you can come up with a good decision making. So that's my
So
opinion.
you see, Zul, actually OMFS, right, is beyond just cutting. I think the team is perfect. You have to have emotional strength, psychological
Kena selalu
strength.
pergi healing lah kita ni.
Dah pergi cuti selalu.
Betul.
Kalau emotion dia clouds your
Because you can
decision
cut, but you
everything
cannot
kan.
focus. It's
It's
also
human, right?
Betul.
Kan?
And then
I agree with
you just enjoy lah kan, enjoy doing it.
Yeah,
Jangan
I think
too
that's the
stressful
most
lah.
important
Stressful
thing.
pun tak boleh juga. Chill lah, chill.
Ingat ya, adik-adik Faido tu. Faido Endop, sorry. Faido zaman kita. Chill.
Yes,
Okay, now we go for about next segment about academic, clinical and service balance.
Quite intense juga.
Intense soalan
Intense.
Intense soalan
Let's start.
Agak mencabar.
Ini salah Mr. Fahmi lah ni Okay. So we start with ni lah Mr. Rahman dulu lah. Okay. How do you balance your clinical workload with academic, teaching, administrative responsibilities? You are also the head of postgraduate program for OMFS in UKM. Spill.
That's a very good question.
Very good question.
I think honestly, I don't think you can balance.
You can.
You just have to integrate it.
Yeah.
If you're trying to say that, because if you're trying to say that this is clinical time, this is academic time, this is teaching time, that ideal does not exist.
Well, yeah, there's no ideal.
Yeah.
There's no
So
ideal.
you have to accept. Okay, like for me lah, I have to accept that I'm in the university. I chose to be there, right? So I cannot say I don't want to teach. I cannot say I don't want to operate because we are surgeons. I also cannot say that I don't want admin work. We have to. That is the deal.
That's the KPI.
Yeah. So kalau you dah sendiri yang apply masuk, then you have to learn how to manage. And yes, I say the main thing is you cannot have. I don't think if people ask about work-life balance, I don't think it exists lah, Azwin. Seriously speaking, but you have to.
You
Just
disagree
integrate
there's a
it and
work-life
live.
balance.
Betul.
You must not be stressed also lah, kan? So for me, I try to integrate the research component into the clinical work daily.
Okay.
So that covers that, and
Better, right?
yes.
Kill to stone with.
So and that I feel that is the amazing part of academia lah. Because we can use the students to read the papers. That's what you give them homework, you read, and then indirectly,
janganlah bocor
then you,
rahsia.
But that's how you have to. It's a teamwork
That's the reality.
anyway.
That's teamwork. There's a keyword, teamwork.
You need everyone actually.
can
The
work
students have important role for us as well.
Yeah.
Because when they bring new knowledge, then we also learn at our level to apply clinical knowledge and critically appraise it. Because that skill they don't have yet. We of course have the traditional thinking, and then we learn new things and we try to rationalize it. And that discussion, I think, allows us to grow as well. They to grow at their level. So I feel that we cannot think that alah kena baca paper. But we make that into something that we can make use to grow ourselves as well lah. Admin is admin lah. You have to do that. Someone has to
Cannot
do
run
that.
lah
Yeah,
from
you
admin.
can't run away. Even if you're in ministry,
someone,
you have to do that. So,
also,
and that is also part of professional conduct, ethics, which also develops you to become a leader at some point.
True.
So I
That
think
one also needs skills lah.
Yeah, that one, yes.
Yeah.
And none of us
Administrative
are
skills.
trained for that, to be honest.
Yeah.
You know, when we came back, they straight away check out, okay, set exam question.
Yes.
There's none of us that we are
Learn
not
yourself.
correct, and we learn through that lah. So the education academia is actually you're always learning.
Betul.
Yeah.
Agree.
Okay. Okay, kalau Mr. Azim pula, do you see any difference between academic practicing clinician and practicing surgeons like in KKM or in private practice? Ada difference tak?
From my perspective, my
Jujur tau.
perspective lah. Jujur. Of course lah, in KKM, our main focus is public services. Okay, memang public services, memang kita aim for services to the public. For university, I'm sure they have also have a KPI. You know lah, my wife in university kan. So,
jawab betul ni.
it's not easy. It's not easy because you have to teach the undergrad, the postgrad, and then at the same time, you lari pergi ke hospital and then to do cases. It's not easy lah. And then for in private pula, I think challenging juga. Why? Because you get different type of patients. Demanding patients. Can have a demanding patients in private. So that's another stress lah, in my opinion. So ada difference, but you have to live with it.
I think people need to always remember not to compare lah. I
Yalah,
feel
betul.
everyone is actually
Soalan ni
semua
salah.
kena cakap pahami ni.
The question.
But yeah, it is everyone has a role and in different levels kan.
Tapi I've heard now in KKM, they started to like has a research day where your officers need to
Adalah,
publish.
yes.
They are encouraged to
Adalah.
to do research and
Correct,
publish
betul.
paper,
We
right?
encourage that. And then ada KPI pun, untuk jabatan, right? Tak banyak lah macam
banyak.
university
Yeah.
lah, but
Yelah,
at least we want
Tapi
to
got
develop the
something, kan?
culture lah.
Yes.
The culture. And in my opinion pun, for our young officers, right, it's good to
Yes.
do research
Yes,
because this is
correct.
their macam stepping stone to go
Correct.
for master
Correct,
program.
yes.
It's true.
Kan.
Yep.
Tapi zaman kita dulu nasib baik kan, tak kena rasa buat.
we were just lucky.
True clinician.
Yeah.
Clinician 100 hari. Okay, right. So, okay.
But you see the younger ones, the ones that are inspiring to become surgeons, I feel the only way you can show that you're really interested. This I speak as when the young ones apply for postgraduate training, right?
During interview lah.
Yes, when we interview okay, let's face it, everyone will say you're passionate about OMFS. That's a
Okay.
standard line that must come out, right?
That's a lie.
But lie or not,
Editor
don't know lah.
interview
But
like a-
you know, when you're interviewing so many people, the only way that you can show that you're really, doing it is presentations
Yes.
in Maoms. These are the platforms that we have, and the more you present, it shows us you are interested.
Yeah, you need to have this extra thing.
Yeah.
Right?
So these are tips for those that are applying for postgraduate.
Betul.
Yeah.
Betul.
Okay. All right. So, okay, that's kita akan ke segmen seterusnya. Okay, human side of the surgeon. Okay, soalan ni relax.
Okay, relax ya.
Okay.
Chill.
So,
Tak stress juga.
ada 3 soalan yang anda kena pilih. Okay, outside of OMFS, what keeps you grounded?
My children.
Your children. How many children do you have, Mr. Rama?
2 girls.
2 girls. Oh my
I got married late, so but yeah. So I think family is important.
Betul.
Your titles are lost at the dinner table, correct? So, and I think that's where you learn to be a human when you don't have, and then you realize how you indirectly what you learn from children, you start to apply in teaching the younger ones indirectly. So yeah, so I think outside I learn a lot from my children, and
Any other hobby?
well, I used to go to the gym, but you
Yeah,
can
kan?
see that,
I can see that.
that's not happening anymore based on appearance, right? Well, but I used to love running.
Yeah, you used to
but-
love running, right? Last
Yeah,
time.
but I still can run, but just much slower. That's all.
Okay.
Age factor. Okay.
Break the knees. Yeah. So other than that, I think most of the time it's doing the other OMFS things which I still do, like the AO stuff. I encourage our OMFS Malaysia
Okay.
to join AO. I just told Azwin as well.
Okay.
Because I feel AO is a very good platform to train young surgeons, and we can always work together with everyone.
Ya, betul.
So these are my other things that I do. Of course, I do give talks, and these are all the other activities besides being in the university. And these things, for me, when I talk in medical, thoracic or anything medical driven, it's indirectly spreading OMFS. So that's another joy I like doing.
Okay, good.
Yeah.
Good.
Okay, how about you, Mr. Azwin?
Things that keep me grounded, of course lah, my kids and my
Kids
wife
kan?
lah. Because semua orang tahu kan, because I like PJJ lah, for 13 years of PJJ. Semua orang macam, wah, macam mana apa ni.
And he
pop
does
up,
carpentry also.
yeah,
Saya tengok buat swimming pool.
I enjoy DIY lah.
DIY kan?
DIY, suka lah buat benda-benda kat rumah kan. So I enjoy it.
So you apply your skills kat surgery tu buat pintu pagar.
Tak adalah macam because my dad is good at carpentry. Memang dia pun memang apa ni lah, pandai buat DIY lah. So I think I follow lah yang tu. And then because macam during weekdays kan, I'm in clinic, weekend, so I have to be present lah for my as father and as husband to my wife and my kids lah. So weekend tu memang nothing about work. Okay, spend time with the kids lah. And then now my kids pun kecil lagi kan. So sekarang sibuk lah, hari Sabtu Ahad tu hantar ke sana hantar ke sini kan for ni game dia apalah semua.
I think it's very important that whenever you are in this field OMFS, your support, you must have something else lah,
Betul.
where you release your stress and you look at different things.
Yes.
So family, I think, is one.
Yeah.
And you learn.
Kids grow kan.
Yeah.
You takkan jumpa dia orang waktu kecil.
Which is
lagi.
true. Kalau I calculate kan, I just manage to see my kids lah kan, to be present with my kids kan, like twice a week.
Twice
And then
a
you
week,
just darab lah berapa setahun, berapa hari saja kan.
Yeah.
So I have to make sure that during the weekends tu is a quality weekend lah with them.
Weekend. You play music right as well, right? If I'm not
Dulu-dulu lah,
mistaken,
dah
I stop
lama
juga
lah.
TikTok.
Dah lama tak.
Oh, tak main lagi dah.
Tak main lah dulu. Tapi dulu kita ada ni lah, kita ada band dulu
kan?
dengan Prophet Daus.
Yeah.
Dengan the Faiz Khalid, the Angkasawan.
Angkasawan.
Then Prof Zainal, Datuk Zainal main flute.
Okay, interesting. Alright. So, okay, kita tanya soalan, kembali kepada soalan yang utama.
Okay.
Okay. Do you foresee OMFS becoming more subspecialized or more holistic and integrated with other discipline? Adakah satu hari nanti?
Well, if you ask me, I think we should and we need to. I always believe that if we don't expand and we don't accept new challenges, we are the ones that are going to be left behind.
Ya, betul.
You know, so even when we went for, of course, if you go to the American Association and all this, they do much more. They do thyroid and all those things because they are subspecialty under surgery. Tapi I feel that in the local setting, there is a need for us to expand and look beyond what has been our training before.
Betul.
Because the new generation are going to face much more restrictions if we as a specialty do not expand. So I believe we need to adapt.
We have to, because the number of dentists now pun dah banyak kan.
Correct. And even even the training syllabus needs to be expanded. If ever it happens, I believe our postgraduate programs, if we have medical training inside incorporated, I mean that should be the way forward. In that sense, it's still very restricted. You know? Because if you look like for us, the ones that were doing it right, we started off with dental school.
Betul.
And then lepas tu buat master compulsory service 3 tahun. And then go and do masters.
And
Datang
then
balik and then buat gazettement and then after that you have to apply, tengok boleh dapat ke tak boleh. And then join, and even then you have to beg the medical faculty to take you. And then after that habis housemanship. So housemanship you have to go and ask kalau you dah larat nak buat sama. So I remember when I went, it was very lonely because when I went, I remember I went to the Malaysian Medical Council. And I said I want to do my housemanship. And then they told me, okay, you have to join Ministry of Health. And then I had to write a letter to me. All this is alone, There is nobody that can help me. So I wrote to Ministry of Health. You know what Ministry of Health told me? You left us many years ago. So if you want to join, you join as U41. I was 56 that time. I said, of course, no way lah. Money is still important, despite how much I love this profession. So then I went to Lucky. HUKM is a training center for housemanship.
Lucky.
So then I have to go and see the pengarah back, and then pengarah said okay, and then you have to ask for pelepasan from your work. So it's very unstructured. It's like very individual, ad hoc basis.
Yeah.
So I feel the only way forward, if you want to get accepted and integrated and allow for bigger trainings, is the local programs have to work together, integrate. So whoever wants, then you are done in, it's a very structured pathway. Tak ada berhenti macam ni.
Like 6 years program.
6 years program. And you complete everything.
Yeah.
So
From the beginning, right? From the undergraduate level.
No.
Undergrad mungkin susah. Maybe from after when they join masters. So we can select a few that you need a few to let the specialty grow. That would be the best lah.
What do you think?
Betul? I agree. I agree. But because I'm from KKM, right?
Yeah.
So of course the focus is public services.
Yes.
Maybe ada ramai tak tahu lah. I joined MBBS juga after Profit Daus.
Yes.
Sekejap je.
But
during that time
something happened.
The apa ni lah, because KKM we have to focus on ada restrictions lah, because our focus in public services, and then ada apa ni policy semua kan. So keluarlah balik, and then my friend dekat UM kan, saya cakap nama kau ada lagi dalam list nama ni kan, dalam kehadiran ni kan, kau mana ni kan. And then that's why I just focus lah, and then after that I know that's not the pathway lah in KKM kan. So I straight away go for area of special interest lah for 2 years.
So having said that, you agree that we needed this double qualification in the future?
That's a very double-edged sword question you're asking me, right?
Of course, you will say you agree,
definitely, it's a benefit. Now, it depends how you look at it. It's not that when you have medical degree, you're better off than a single. It's not that. When you have double degree, you give strength to your specialty. People cannot come and, I mean, the biggest problem we have is always people telling us that you are dental, you're dental. And that used to irritate me. One of the reasons I really wanted to do was also that, because when you go to any combined clinic or anything, then it's, you're just dental. Now, what do you mean I'm just dental? So I had that in me. And yes, so I think the only way, people always say education only can give you strength. You can talk and fight with people, but they will still come back to that one point. So that has to be something that we have to go forward, at least to keep the specialty strength. Because even in the overseas, when people ask us to use the guidelines of OMFS when we do our training, but those are based on double degree holders most of the time.
Betul.
So I feel that's the way forward lah. What do you think?
Yeah, betul. I always believe that if you have you're doubly qualified, you can be a better clinicians. Okay, but again with that pun, the training pun also important juga lah. But of course nowadays in our environment lah, it's not ideal. It's not ideal. Our now master boleh masuk pun after 5 years. After 5 years, most of them dah umur berapa?
That's the thing. There's so much of restriction.
And then if you go, I think my candidate pun masuk umur berapa? 35.
Correct.
35.
Macam mana nak ni?
4 years, 39. At the age of 41, you want to start becoming a specialist kan? Or I think.
And in OMFS is very technical. You need your stability of your hands and eyes.
When is the long and productive career dekat situ? So these are the things that kena tengok lah. Tengok balik lah. Maybe itulah. In terms of the environment, is it ideal or not lah?
Okay, alright. Very interesting discussion.
Yep.
Now kita ke zaman akan datang.
Okay.
we talk about AI.
Oh.
Okay. So what do you think? How will digital technologies, AI, virtual planning? I think now kita pun dah banyak kan buat virtual planning, surgical navigation surgery, and 3D printing. Do you think this will reshape the OMFS practice as a whole?
Practice, definitely. I think we have to embrace
It's a game changer.
It's a game changer.
Yeah.
But we must also realize that the younger ones that are now just doing AI, we have the benefit that we have principles and we have been trained the conventional way, right? But when you are fully AI driven, sometimes you don't know
The conversion.
the conventional way. You can also get in trouble.
Yes.
You know, with AI, they say rubbish in, rubbish out also. So, but it's definitely the way forward. You have to adopt it. Universities need to adopt
Cannot
this
deny
thing.
the importance of
You
it,
cannot
right?
deny. It's about precision. It's about patient outcomes. But I think the principles still cannot be lost in that training. It makes you responsibility, and the ethical part of it comes from the training. So it needs to be still incorporated in, and I guess that's the future lah. You already see when I went to Beijing the other day for the AO, they were doing their first robot-driven automatic surgery.
The robot is
Then I was like,
replacing you.
what, you mean the robot is actually doing the cuts, and they said apparently the outcome was good.
Yeah.
That was the first case when
First case.
they were doing. So
Yeah,
you
we
know.
were discussing juga lah about doing robotic surgery. Yep.
Kan?
Actually
Yeah.
ada sensor kan
Yes,
untuk kalau
yes.
even the patient move sikit kan dia akan sensor.
yes.
Dia ada safety mechanism
Yes.
lah which I'm not very sure. But in my opinion, right, virtual surgical planning, 3D printing is well documented. But AI semua kan, it's supposed to be a decision support, not a decision making.
yes, correct.
Responsibility still goes to the surgeons. So I think it's a good support system lah during
Yeah.
AI semua ni. But still, you as a surgeon have to make the decisions.
correct.
Betul.
We cannot rely totally 100% on the technology.
Betul. Sometimes,
Still the human
yeah.
touch.
Sometimes when we do virtual surgical planning kan, katakanlah in my scenario lah, kata nak cut the tumor, lepas tu tiba-tiba tumor tu terlebih sikit, kan, dah lari dah daripada apa yang kita plan tu. So if you think and you don't really rely on what's planned virtually, so you know how to rectify the problem, to troubleshooting. So it's important juga to
Yes,
see
definitely.
that perspective.
Okay. So having said that, will future OMFS surgeons need stronger technology literacy than surgical skill alone in the
Both
future?
lah.
I mean, 10 years.
Both. I don't think you can remove.
Yeah, both.
I think the psychomotor component will
kena.
only
Still
come
ada.
with because every patient is different.
Betul.
Betul.
The algorithm for AI is standard,
Yeah.
but it still depends on your prompt, right? With
Yeah.
ChatGPT and all
Ada
this.
banyak.
So every patient bone quality is different. Their emotional and expectations are different. So you cannot have a rigid, structured solution to every patient.
Betul.
And that only a human can do. That's why I feel OMFS is still medical feel a bit hard for. I feel lah, but I don't know. Who knows?
Yelah.
For a computer
OMFS,
takeover,
I
I
think
don't
we
think.
still need a
yes,
surgical
you still need
skills
that.
lah.
Kita still
Yeah.
Still need skills, tactile
dexterity,
skills.
Correct.
kena
There's a lot of
power,
feel and tactile
dexterity,
in
tactile dan
yes.
sebagainya kan.
Yep.
Okay. Imaging technologies excite you the most. What the imaging, technology excite you the most? Ada yang tak yang ada overhype, rasa macam overrated? Tak
I
ada.
think
Semua important tak?
For me, yeah.
Like me, I'm interested to try dynamic navigation,
Dynamic.
real time navigations. Macam like my case lah kan, maxillectomy to put a zygoma implant, right? So sometimes kalau kita buat on atrophy ridge is senang because we still have alveolar bone as a guide. When you lost your maxilla kan, you don't know dah. Of
Yeah.
course lah, nowadays we use what we call analog surgical stand, an analog guide lah daripada tu kan. Tapi when you have a real-time navigation kan, I think it's interesting lah. I know they're doing it now lah in some clinic pun dah buat lah real-time navigation, which is I think I'm interested lah to venture into it, but it's very expensive lah. Tapi yang overhype ya, I rasa macam ni lah kot augmented reality.
Augmented reality,
Yeah.
Augmented
AR.
reality, yeah,
AR.
AR. But they have been doing it for spine surgery. But for soft tissue, I'm not sure lah. Augmented reality, yang kita boleh tengok kan,
Yeah.
of course. But during the planning, I think it's okay. But during the real intraoperative apa ni kan, session.
don't think
I'm not sure lah. I'm
really
not
works?
sure. I don't have experience on that.
We have tried that in UKM where we taught the ID block using AR.
Yes.
Tapi when we find that when they practice, they still
Yeah.
cannot get the block. so yeah, I don't think it's
Overhyped lah. You think it's overhyped?
overhyped. But in this current generation, you need to have that.
Betul.
They get interested with this kind of thing, so they need to just know the limits, and I think that's our duty lah as surgeons.
As for you, Mr. Rahman, do you any in the pipeline, any device
No.
you have with sleep apnea, or you don't want to share with us?
Nah, not yet. It's classified information.
Okay, all right. I respect
Wait for
that.
it.
I respect that. Okay, now we go to the next segment, training, education and workforce. And currently, I ada buat research tadi, I tanya kawan kat KKM. We have to date, no, not to date. I mean, like by the end of year 2024,
Okay.
December, we only have 209 registered OMFS specialists. Okay, I do search also dekat Singapore pun lebih kurang sama 150. Philippines and Thailand pun around 300. Kan, that means, do you think cukup tak 200 max vaccination to cover the whole 35
definitely
million?
no. That
Logically memang tak cukup lah kan.
definitely no. As you can see, even for oncology, he's going everywhere.
Kesian lah.
But that's very special. But you definitely have a shortage lah. We are very niche, right? Only 200, but we are very important
And
specialty.
not tak semua lah.
Yeah.
Berarti macam ni kan. Okay. Right. Is the current OMFS training model sufficient to prepare future surgeons for what lies ahead? Okay. Mr. Rahman, I think you the best person to answer it.
Well, you must understand in university, the training is just to make you to the initial formation of a OMFS. So the growth happens from that point onwards. And that's why at the moment, I would say the scope that you can cover in 3 years, now it's a 1+3 program, right? Is focused on the main core of OMFS.
The core procedure
The core
lah,
procedures, yes. I think it is at the moment enough.
Adequate.
Cukup.
That we
For
will
core
ask
procedure,
Azwin.
yes.
if
At the
it-
end user kan?
Yeah, they are the end
You yang the one.
Yeah, most of them will come to
So that's where they get trained.
KKM,
further,
Okay,
yeah.
yeah. Training.
For core
okay.
procedure, yes, is adequate. Adequate.
Yeah, because we don't train them to really go out and straight away be able to do many.
cannot lah.
Yeah, but they must already have the principles, the ethics, the professionalism, and patient management
The foundation.
to make sure that they do not harm patient. That's our
most
main.
importantly, I think to be a safe surgeon.
To be a safe. I think that is our
surgeon.
aim in
Yes.
university. Safe, of course, and then with cognitive levels enough to reach, to make decisions at least when they become standing alone surgeons. The training, I mean, we have to agree. Psychomotor takes time. You have to see more and more cases. Every trauma is different. And you learn in a team. Every case is
As
different.
you go
right?
lah, as you go, you learn.
You learn.
You develop your own skills
Correct.
sebenarnya to become.
and that has to be your own personal. That's why I always say that after you graduate, you have to have the initiative to keep going and improving yourself. I mean, going for courses, going outside. You have to go outside and see what other people are doing. If you think that just graduating as a MFS is enough, then you will always be.
Yeah.
You look like Azwin. I mean, it's a big jump to go to a country where it's not your own.
Non-native.
But you see, he made that jump because he knows that it's important.
But you know why I jumped or not?
Oh, kenapa?
Because
Cerita
no. I follow advice from my mentor,
Oh, yeah,
Datuk Yusof
correct.
lah. Datuk Yusof dia cakap kan, when you start to feel comfortable, it's time for you to move on.
Yes.
Yeah, okay. So betul lah. I think betul.
correct,
When you start to feel comfortable kan, you must start doing something new lah, so that you can develop yourself.
Correct.
So betul.
And it's harder to go when you're already working. Kan? When you're already a specialist, it's harder to go. Even like for me, right, when I did my MBBS, so of course everyone say go. Okay, I wanted to do it, yes. And then when I entered, I still remember first day, I entered. that whole big decay, and then they see one. They thought I was the lecturer.
Yeah, betul, sama lah.
I duduk paling belakang sekali, and I felt
Backbenchers,
out of, and you know, I think the first 2 weeks I didn't know what was going on because I felt lost. I was alone. These are all new people. They're younger than me, and then I was wondering, should I do this? Should I not do this? And then after that, you know, you have to know the bigger picture lah. I think same thing when you want to go and subspecialize also, you always will have that, alamak lepas ni pergi, who's going to take care of my family? I cannot do locum. You know, all those things come in. These are real life issues, right?
Banyak persoalan.
Yeah, and you tend to go back to your comfort zone. So the trick is you must be brave to sometimes leave your comfort zone and go and get the training, because when you come back, those are very valuable.
Yeah. Because if you sacrifice pun kan, let's say you sacrifice about 2 years,
Yes,
kan?
yes.
So for that 2 years that you can benefit your skills kan for another 20 years.
Yes,
Yeah.
correct.
Utilize
Beza.
it correctly. So, okay, what common mistake do young specialists make early in their careers? Yang you can see, mesti jawab.
Oh boleh. When
dia punya product
of course
keluar.
we all semua kan when we were young and
Common
dangerous,
mistake
right? I think semua orang lah. We also pernah when we were young and dangerous, we always want to cut.
Yeah.
Kan? So kita nak cut saja. But I think it's my advice kan to the young surgeons, right? Always have with you one mentor. Okay? One mentor, and then if you have cases you want to share with to get opinion, go to your mentor. That's very important lah. Mentor ni sometimes macam mana cakap kan, we know when not to cut.
Yes, correct.
Right.
It's
The most experienced person, they know when not to cut. Itu yang ambil masa lama for experienced surgeons. So it's very important lah to have someone to be as your mentor. Like I think we all semua pernah ada mentor our own, right?
Yes.
So it's very important itu.
So always
the mentor.
Always my mentor always say, so as when you see the trainees as well, they're always rushing for cases, right? They got this case because they just want to cut. Okay, fine.
The hand is itchy.
Yeah, the hand is itchy. But you know, because they have not seen complications.
Yep.
Right. Once you see it, they can break you as well. But what our mentors always used to say is always diagnosis. That's why, you know, in university, that's what our aim is.
Yes.
And sometimes they get frustrated because they're like, why so much time discuss? So I always feel reflective learning is very, very important. So you must reflect on every case that you see, rather than just go into, you know, cut and then habis, oh, I got my requirement. Because nothing is perfect. There will be always something to learn from every patient, which I tell my students all the time. Reflective learning is the way to go forward. And that's the error lah. But we all have to fall lah. You have to fall. Hopefully you don't fall too hard. The reason we are always hesitant because we have seen the complication, right?
Betul.
So
And then we don't want that complication to happen to our young
correct.
surgeons.
And the end of the day, we are thinking about the patient lah, right? So yeah, so I think that is. But everyone learns lah. When you are in that boat, you don't think that way, right? Now we are thinking that way because we have passed that boat. Yeah, but.
Because we also don't want the young surgeon to repeat the same mistake
Yes.
that we did.
Yes.
So, tapi depends on mentor lah. Kalau mentor nak share kan,
Correct.
their experience, so I think it's very important lah.
Yeah.
That's why we must have.
Because obviously the young ones, right? They always have this thing like, oh, the surgeon operate very fast. They love that
Faster
time.
better kan.
Yeah, but you see, that doesn't mean that is your aim. Your aim is always to ensure that you have, you know, done the best for the patient. If it takes slower, it's okay.
Yeah.
As long as you're a safe surgeon.
Correct. There's never been anyone that has been, you know, taken to court for being too slow. Kan? But you get complication is different.
Apa yang dikecil. Tapi ada tak trainees you came back to you? I mean, like, ask your advice after they graduated. Ada tak?
Ada, kita ada WhatsApp group.
Liza.
Ketuk-ketuk semua orang. No, of course. Some do come back and ask. And yeah, we share with them.
But it's good lah sebenarnya.
Yeah.
It's good because sometimes you need some people to guide you.
Yes.
Yeah, before you matured in your surgery kan.
Correct.
Betul.
Okay. Right. So, kita dah nak 1 jam 10 minit kan?
Oh yeah.
Oh, ya ke?
Okay.
Style masa lagi.
Apa tu? Okay. Ini kembali kepada dental students. Okay, what advice would you give to dental students who are considering OMFS but feel uncertain about the long training pathway? You know, some student kita yang graduate ni kan kata, oh, dia nampak kita macam hebat cabut gigi buat MOS 5 minit. I want to become a surgeon. I want to become this surgeon. Sedangkan dia tak tahu dekat hospital tu macam mana kan. Because I ada my student yang mula dia minat masuk nak become oral surgeon, tapi bila start on call, the real time dia kata, saya tak minat lah kata. Dia kata, this is too much. Kata, I nak duduk rumah jadi isteri. What do you comment? What do you advise?
My advice, if you are passion kan about oral surgery kan, you love to work in hospital base. You think that you can learn skills, okay? Because skills can be learned, I think.
Yep.
Plus, if you have talent, go for it.
Yeah, I think we should always encourage.
Encourage, right?
Encourage rather than discourage, because that enthusiasm they will learn lah later. So we shouldn't shoot down the enthusiasm, because if they really are keen, then guide them. That's why even what we don't have here in Malaysia is like a young oral maxillofacial this thing. In Hong Kong they have something called YOMS. So actually they do, especially for dental students. It's very OS driven, but it's make it in a fun way. And the idea is to cultivate the interest and make them really, really want to do OS.
You did that in UKM?
No. But this is something that you see. But of course, then when they start working, they will realize lah. So I feel like university level we shouldn't discourage.
But I think ramai juga kan yang apply for aspect, right?
Yes.
Postgraduate degree.
Postgraduate, yes. So postgraduate, yes.
Not
And
like
in fact-
during our time.
Correct,
tak ada orang.
correct.
Dan kita tahun tu only 3 universities,
Okay.
UKM, USM je kan. So tak ramai.
Betul.
Tapi kan kita ramai kan, kita sebagai lecturers kan, sometimes we can see student ni ada potential, betul tak?
Yes.
Kan?
Yes.
Tengok dia punya cara dia suture,
Yes.
confidence level dia kan, sometimes we can, kan?
Macam we all work from
kan?
KKM lah, when
You all boleh tengok.
students
know
comes
the
kan for
attitude,
attachment,
yes.
we already know lah.
Yeah,
Kita tak
who
cakap
will
je.
We tak cakap kan?
Yeah,
Okay,
yeah,
kalau
correct.
Cuma kita tak cakap. Yeah.
But I always tell them the ones having interest and showing on paper that you are actually, portraying the interest is very important. Once again, especially when you're going for a postgraduate, you cannot just keep telling that you are interested in. You have to,
Show.
So at your level, what
effort
can you do? Go for courses, go for, MAOMS is the best.
Yes.
Yeah, and then actively participate. You will shine, right? When you shine, automatically when you come, people will see you.
Betul.
So it is always a pattern recognition that works most of the time. You see someone's face all the time there, winning the MAOMS, this thing. Obviously, the impact is better, right?
kan?
Than someone that we've never seen.
Dulu sebenarnya lagi best because we do oral presentations.
Yes,
kan?
yes, correct.
But now because too many
correct.
kan, so kita terpaksa buat poster, right?
yes,
But I
yes.
think last time lagi interesting
correct.
because we can see the potential
Yes,
yang
yes,
those yang ada
yes.
potential.
Okay, alright. So we almost about to end, tapi kita ada beberapa minit lagi Dr. Fahmi. So kita nak reflect sikit lah. Okay. So when you reflect on your journey so far, what are you most proud of? Apa yang
Proud of.
sepanjang
Proud
journey
of.
are proud of. Apa yang membanggakan you?
Okay.
It's not for you to brag.
Ni lah.
anything.
Okay. Proud of kan? Okay lah.
Apa yang you bangga sepanjang apa?
I'm proud of my junior can handle complications.
Oh.
Because I travel kan, certain hospital yang ada case kan, happens one case lah. They operated a few days, and then I went back to Kuantan. 3 o'clock, they call me. Doktor, bleeding from the neck, kan? And then dia kena masuk juga because dah masuk emergency OT. So I say, pukul 3 pagi kena pergi KT ke ni kan? Tersebut lah je. kena pergi.
Beep.
So I cakap tapi dia okay tak apa saya masuk juga lah, no choice. Okay, masuk. But then I just guide them through phone. And then they're able to identify where's the bleeding source and then ligate the vessels. it happened twice tau.
Twice.
Satu from the neck, dan satu lagi from the flap lah. Kita buat apa ni lah, pedicle flap saja, bleeding from the flap. So they went in, and then they rectified the problem themselves. I'm proud of that lah sebenarnya.
Yeah, betul.
Yeah.
You must feel like, oh, I'm doing something right.
Yeah, because that's why I think sometimes when you assisting your surgeons kan, you observe a surgery, you also learn sebenarnya.
Betul.
Yeah.
And then watching a surgery and observing a surgery, two different things.
Correct.
Observe when you see, and then you think what the surgeons are doing, and then you buat macam defensive reading kan.
Yes.
What's happening next macam tu. So that's the moment yang I think I'm proud of, when I see my juniors can do things that yang quite specialized lah. Tu je.
Okay.
Yep.
How about you?
Yeah, so I think totally agree with you. So I think we should ever be proud of ourselves lah kan. I mean, proudness must be something that you see that you have benefited other people, I feel. For me, I think what I can recall, because I do the applied medicine course for the first year's postgraduate, all specialties. So we always get the medical examiners to come. And then when they are able to answer their questions, that's quite right. In fact, the last time the person came said, the level is almost like the medical students. So that, I think those kind of things make you happy lah. As a teacher, you know. And that's what we look for. Cikgu tak malu. Cikgu tak malu. Kalau tak kadang-kadang
boleh berdebar juga kan. Boleh jawab ni kan. Kalau dapat jawab.
And yeah, I think we all, when the exit exams, when the external examiners, you know, say that the program is up to standard, I think those are things that make you happy lah. Because wherever we stand is always because of the whole team. Even like for all of us, I think for us to go for training, there's somebody else that has to cover us. You know, so it's always a teamwork, no matter how you see it lah. During surgery pun teamwork. Even for you to go training, it requires other people to cover you. So we always work as a team in OMFS, I feel.
So, what legacy do you hope to leave within the OMFS community? Maybe one day kita kan nak retire. Apa semua. Probably you all takkan retire lah kot.
Kena lah retire. Everyone will retire.
Kan? What legacy, apa yang you nak hope to leave within
I
the
hope
community?
to leave a structured postgraduate training program,
very academic
which include a medical training for all OMFS.
Okay.
I hope. But it is not easy. Yeah. But we can dream. There's no harm in dreaming. But yeah, we need the right people to help policymakers to come in. And I think having International OMFS Day is excellent, because that highlights us on the front. You know, people start asking, especially when all of us put on Facebook, all that. You know, my mom and dad today can't pronounce the specialty. You know, they will say oral maxi. And then people ask them why he did medicine. I don't know, he wanted to do. So, you know, so it is across the board. Not many people know exactly what we do, even though we think it's a given, right? It's not. So I think first is, of course, we need to be seen. And then we need to slowly try to these things. So I hope that can happen. That is what I hope.
Okay, how about you?
The legacy, I think, I want to see our juniors can be better than us.
Of course.
Okay, and then let our work, our hand speaks for itself. Let our work do the talking. So itu sajalah, I think. So we have set up such a standard.
Yeah.
So our juniors must be better than us.
Yeah.
Yes. Kalau kita still sama saja, yang kita takkan apa ni lah.
Yeah.
Spend.
Alright. I think that's the time we have. Kita tengok ada tak ada soalan-soalan daripada ni. Okay, kalau tak ada soalan. Okay, alright. So,
Crystal clear.
1 hour 30 minutes. Initially we thought like ini 40 minit dah settle dah ni. Tapi, you know, a lot of things to. Okay, so that's the end of our session today. Thank you so much to Mr. Rama, Mr. Azwin for
Thank you so much.
taking your
you.
time.
Thank you.
Malam minta ongkol kan? Tak ada ongkol kan? Alhamdulillah. For your thought, inspiring stories, you know, sharing your journey, the ups and downs, your wisdom and expertise truly enrich our discussion today. And to our audience kat rumah, okay, we appreciate your engagement and hope you found value into this discussion. Don't forget again to subscribe Moms punya YouTube.
Yeah.
Tune in the next week. Next week pula. Next year, 13 February for another exciting episode. Until next time, stay curious. Okay, get your wisdom on. Okay, to our Chinese friend, I think it's
恭喜發財。
大家嘅恭喜發財，
新年快樂。
新年快樂，恭喜發財，紅包拿來。
Our
And to our
Muslim
Muslim friend,
selamat berpuasa.
selamat berpuasa, Eid Mubarak. Okay, thank you once again.
Thank you
Gentlemen,
so much.
Thank
happy
you.
to have you. And last one kita sebutlah, Happy
International OMFS
Oral
Day.
Maxillofacial Day.
See you.
Sekian. Assalamualaikum
Bye.
warahmatullahi and good night.